Hi, I'm Aziz Alawadhi and this is my presentation on yellow fever. Yellow fever is an acute viral hemorrhagic disease. The yellow refers to the jaundice that affects some patients. The virus is transmitted by infected mosquitoes, and without treatment, 50% of severe cases are fatal. There are 200,000 cases per year and 30,000 deaths per year. Yellow fever is endemic to both Africa and South America. However, 90% of cases occur in Africa. In the last 2 decades, there have been increases in the cases of yellow fever due to deforestation, urbanization, population movement, and climate change. Scientists have yet to find a cure for yellow fever. Treatment today aims to reduce symptoms for the comfort of the patient. The first recorded outbreak of yellow fever was in 1647 on the island of Barbados. Other significant outbreaks include New York in 1668 and Philadelphia in 1793, the latter of which forced then-President George Washington to evacuate the city, which was the capital of the United States at that time. Yellow fever was the first disease to ever be linked to mosquitoes. The link was made by doctors Walter Reed and Carlos Finlay. The yellow fever virus is transmitted by Aedes aegypti, of class Insecta, order Diptera, family Calicida, subfamily Calicinae, genus Aedes, and species Aegypti. Only females feed on blood, so only females can transmit the disease. Females feed in the day. The mosquito undergoes complete metamorphosis with an egg, larva, pupa, nymph, and adult stage. Here we see an Aedes aegypti adult feeding on a human host. The yellow fever virus originated in Africa in monkeys and was transmitted to humans by Aedes africanus. Human-to-human transmission is facilitated by Aedes aegypti. The agent of infection is a group 4 positive sense single-stranded RNA virus called yellow fever virus. It's of the family Flaviviridae and the genus Flavivirus. The virus has an icosahedral capsid, is enveloped, and has a diameter of 40 to 50 nanometers. Once it enters the bloodstream, it makes its way to the lymph nodes where it replicates in dendritic cells. Progeny virions make their way to the liver, where they infect hepatocytes. In severe cases, this causes cardiovascular shock, multi-organ failure, and death. In order for replication to occur, the virus must attach to receptors on the target cell, for which its spike proteins have high affinity. Receptor-mediated endocytosis engulfs the virion into the cell in an endosome. A drop in the pH of the endosome below 6.6 triggers a fusion of the envelope of the virus and the envelope of the endosome, releasing the nucleocapsid into the cytoplasm. The positive sense RNA genome can act as both mRNA and a template for RNA replication. Translated virion proteins are assembled in the endoplasmic reticulum and transported to the Golgi. A pH drop triggers proteolytic cleavage and exocytosis. Yellow fever is endemic to tropical and subtropical regions of South America and Africa. The virus is thought to have been exported from Africa with its vector with the transport of African slaves to South America. The incubation period for yellow fever is 3 to 6 days followed by an acute infection. Fever, muscle pain, backache, headaches, shivers, loss of appetite, and nausea or vomiting are the main symptoms of the acute infection. Symptoms usually disappear after 3 to 4 days. However, within 24 hours past remission, 15% of patients enter a severe phase of infection. Fever returns, jaundice develops, and abdominal pain with vomiting are experienced. Blood appears in the vomit and feces. Bleeding can occur from the nose, eyes, mouth, and stomach. Kidneys may fail due to deteriorating function. For 50% of these patients, mortality occurs within 10 to 14 days. The other 50% recover with insignificant organ damage. Yellow fever is difficult to diagnose in early stages. It can be confused with severe malaria, dengue hemorrhagic fever, viral hepatitis, or other hemorrhagic fevers and flavivirus infections, for example, West Nile virus. Blood tests can detect yellow fever antibodies produced by the immune system in response to the infection. If virus-specific immunoglobulins are found, that means the person has been infected. Serum is drawn and tested for anti-yellow fever IgM. There is no known causative cure for yellow fever. Symptomatic treatments include rehydration and pain relief with drugs like acetaminophen. Aspirin should not be given because of its anticoagulant effect, which can be devastating in the case of inner bleeding that can occur with yellow fever. A yellow fever vaccine has been available since the mid-20th century and is required for travelers by many African countries. The vaccine is a live attenuated vaccine, meaning it lasts longer. However, there are risks that mutation could reverse the attenuation of the virus. This risk is very low. The vaccine is safe, affordable, and highly effective, with immunity lasting from 30 to 35 years or more. Immunity is effective within 1 week for 95% of those vaccinated. Other prevention methods include wearing insect repellent containing DEET, sleeping in insecticide-sprayed mosquito nets, and staying away from or removing potential mosquito breeding sites, old tires, cans, and calm, fresh bodies of water. Here are some of the sources I used for this presentation. Thank you for listening.